Hello, good day everyone. NurseFelly is back on page. Remember to like, comment and share. Today I will be talking about overactive bladder. An overactive bladder is a situation whereby an individual have frequent urge to micturate. The person cannot control the urge to void. Remember, the bladder is the organ that helps temporarily to store the urine. When little amount of urine is in the bladder, the person is already having an urge to pass out that urine, and this is not the normal situation of the bladder. The bladder can hold urine even more than 4 hours, sometimes depending on how frequent you take fluid. But in the case of this individual, little fluid on injection, before you know what is happening, the urge to pass out urine is there. Somebody will be saying, is it that the person is diabetic? No. Though diabetes can make somebody to visit the washroom often, but we have found out that sometimes people that experience overactive bladder, they are not diabetic after some investigations. Then what then is the cause of overactive bladder? Overactive bladder can be caused as a result of damage to the bladder muscles. The bladder muscle, once it is damaged, it is malfunctioning, you see that the bladder muscle will be contracting. And as it's contracting, the person will be having that urge to go and void. Sometimes it could be as a result of the nerve that stimulates the urge to micturate. Once the nerve is not functioning well, the person will visit the washroom oftentimes. Then, another cause of overactive bladder is untreated UTI, urinary tract infection. The infection can make an individual experience an overactive bladder when it is not managed properly. Another thing that can make them experience this kind of disorder is when there is a trauma to the bladder. Maybe the person had road traffic accident sometimes ago, and he or she did not know that the bladder was injured. And before you know, after some months or few years, the bladder will start malfunctioning. And somebody will be asking, is there not a cure? Is there no treatment when a bladder is experiencing such? Yes. If the cause of the overactive bladder is as a result of infection, the infection will be treated. If the cause of the overactive bladder is as a result of disorder to the muscles of the bladder or the nerve, it can also be handled. But in a situation whereby there is a severe injury to the bladder, sometimes it might not be handled by surgery. So it depends on the severity of the injury. And that is the reason why sometimes if we experience some symptoms which is not normal to you, please, I will advise you, visit the healthcare facility. Go to the hospital so that they will find out what is wrong. Because when you go to the hospital on time, it will not lead to this extreme situation. Then sometimes you will find out that these people are advised to wear absorbable pad. Why do they say absorbable pad? If you use this normal pad, sometimes it might not be able to hold the capacity of the urine. Let's say, for example, the person is in an office, he or she is working, and the urge to micturate is just there, and the washroom is like 3 to 5 minutes away from her sitting position. So with that absorbable pad, it can help to hold the urine without wetting the clothing that they are putting on. So please remember to like, comment and share. Watch out for the next video. Thank you.